It's Dr. Tammy Penhollow. I've been asked several questions that have come up recently that I thought it'd be perfect just to put down on digital. They're some of our frequently asked questions, and hopefully if you're watching this right now, it answers your questions. If you have any additional questions, please reach out at 602-806-7389, Precision Regenerative Medicine. The most common question we get is, so I'd love to have PRP or bone marrow into my joints or spine, but does insurance cover it? I'll tell you, insurance covers, once you've met deductibles and those things, surgeries, destructive procedures like injecting steroids or burning your nerves, which then weakens your muscles. It covers surgeries such as fusion of your spine, replacement of your joints. It covers medications. Honestly, I hope you never have to get to any of those. Insurance, specifically, hospitals, big pharma, and the device manufacturers do not benefit when you're healthy. They only benefit from your injuries and your illness. So if doctors continue to put steroids in your joints, which is paid for, those joints are then degraded faster. The cartilage is eaten away. You're more likely to have a joint replacement earlier than if you didn't have steroid injections. Steroids can also rupture your tendons if it's injected around something like a tennis elbow or a golfer's elbow or some of those other injuries. And as mentioned before, if you have radiofrequency ablation or burning of the nerves, either around the knee or into the neck or into the low back because you've got some pain with this type of motion, or the flexing, extending of your back, that actually, those nerves actually go to the muscles that hold you upright. And it's the exact opposite of what we do when we're focused on your core, or my signature therapy, which is Tower of Power, to strengthen everything from the base of your skull all the way down to your sits muscles. So those muscles get weaker. We know this. We can actually look at an MRI before radiofrequency ablation and an MRI after radiofrequency ablation. And that tenderloin, the piece of meat that you find on animals such as pork or beef, is now not this nice muscular big fiber thing. It's actually atrophied with a bunch of fat. It almost looks like the prime rather than the choice, and that's not good for you. So, insurance does not pay for things that make you healthier, for things that keep you out of the operating room, for things that prolong having to have a surgery. The second most common question is, well, what's it going to feel like? Most people describe the pressure of an injection into their joint, into the tendons, into the meniscus, etc., as pressureful. And that pressure can be pretty significant for maybe 5 minutes or so. I'd say over 95% of my patients have absolutely zero anesthesia associated with it. Only 5% do. And that's not just something where I can put local anesthetic like lidocaine or bupivacaine or marcaine into the PRP or into the bone marrow, because that destroys the platelets, it destroys the growth factors. So on a superficial thing, we can do a little freeze and spray right here at the elbow so you don't feel the needle going directly into the skin. But once we inject the PRP into the joint, into the tendons, or around those ligaments, then you're going to feel pressure. That pressure is typically gone after about 5 minutes. Then we start moving gently, some range of motion. Then we ask you to bring a heat pack that we can put in the microwave, and you go home with the heat pack on. But the very, very majority of people don't have to have any anesthesia, and that would entail being completely out with local anesthetic, having an anesthesia person there, having oxygen monitors, all those things for a procedure. And certainly we can do it. We just roll the cost of that into the procedure. The third most common question we get is, well, how long is it going to take to work? You know, it's not something that's instant. You don't get a toothache and get some numbing medicine and whoo, all of a sudden your tooth doesn't hurt anymore. Your body took some time, unless it was a traumatic injury like an acute tear or pull or strain of, say, the meniscus or the anterior cruciate ligament of the knee. So particularly in the degeneration or the arthritic thing where it's wear and tear, and repetitive injury, it's going to take some time because we're harnessing your body's own cells. We are using your own platelet-rich plasma, which contains the platelets, releases the growth factors, the anti-inflammatory cytokines. When we use the bone marrow, it also has a very special protein called IRAP, and it has your own stem cells, which are mesenchymal signaling cells. And this whole thing means that your body sees the new cells that have been put into this area, and it acts as a honing device, as a signaling. So then it recruits all of the other cells in your body and says, pay attention to this area. We need to start focusing on this area and getting it better, whether that be your elbow, your shoulder, your neck, back, knees, hips, etc. So it doesn't happen fast. In fact, I don't even consider it a success or a failure until 6 to 8 weeks have passed. And then we bring you back in, we reevaluate. You do those standardized pain assessment scores. We put you through range of motion. We talk about what you're able to do and what you may not be able to do. We look at the progress of things. But this is a slower process. It's not instant gratification. But guess what? We look at the longer term benefits from this. This is not a steroid that you inject today. About 72 hours later, you start to feel some benefit. And then about 4 to 6 to 8 weeks later, the benefits are gone. And again, that's just a Band-Aid. It's a temporizing measure. Then you need another steroid. And what do we say about steroids? They destroy the joints. They can cause tendon rupture, let alone the things where we talk about decreased ability to fight infection, increased risk for infection, increased risk for cancer, decreased ability to maintain your blood sugar. So if you're diabetic or pre-diabetic, your blood sugars may go through the roof. And a lot of people see weight gain with steroids. That's a whole nother topic, but those are the 3 most common questions that we get. I hope this helps, and please reach out if you have any other questions. Thank you. To your very best health.